Hello, class. Today we're going to be looking at a couple different things. We're going to look at head, neck, and spine injuries and muscle, bone, and joint injuries. Um, Let me just get my presence on here a little bit. Okay, so let me lower myself down. So, a couple things. One, if you missed the quiz for whatever reason it may be, email me and I will make arrangements that you can retake the quiz. If you're struggling and you say, Mr. Grove, I have had some heart issues, those type of scenarios, please contact me as well. We only have a few weeks left. Hopefully everybody gets through this semester. As crazy as things have been, I wish you all the best. Again, one more time, email me if you have any issues. If you feel that you need a second chance, please do that as well. So today we're going to, let me minimize myself here, and we're going to look at the first part is muscle, bone, and joint injuries. When we talk about these things, I want you to remember R-I-C-E, RICE. Pay attention as we go through. You're going to hear that acronym and what it stands for. Muscle, bone, and joint injuries. Here we go.
Muscle, bone, and joint injuries come in all shapes and sizes, and it's important for you to be able to recognize the different types in order to provide proper care. The four main types of muscle, bone, and joint injuries are fractures, which are a complete break, chip, or crack in a bone; dislocations, which is the movement of a bone at a joint away from its normal position; sprains, which involve the stretching or tearing of ligaments at a joint; and finally, strains, which is the stretching and tearing of muscles or tendons. When minor injuries don't require emergency medical attention, use the R.I.C.E method to care for injured muscles, bones, and joints. This stands for rest. Do not move or straighten the injured area. Immobilize. Stabilize the injured area in the position it was found. Minimizing movement can prevent further injury. Cold. Fill a plastic bag with ice and water, or wrap ice with a damp cloth and apply ice to the injured area for periods of about 20 minutes. If 20 minutes is too much to tolerate, apply for 10 minutes instead. Elevate. Elevate the injured part only if it does not cause more pain. Elevating the injured part may help reduce swelling.
So a couple things here. If it's compound complex fracture, if we're looking at the bone protrudes through the skin, we're looking at a little bit different scenario about the R.I.C.E method. You would try to, that the best position is immobilize the limb, whether it was arm or leg, and transport the person to an emergency care situation. All others, where you talk about with sprains, strains, even dislocations, you can use that R.I.C.E method. So let's go through right now. We're going to go to a scenario. Let me get myself out of it. Start the mission.
Anthony slipped and injured his wrist. The injury does not look severe, so you won't need to call 911, but you can still help by giving care.
Okay, as you always remember, we check the scenario.
Everything looks okay over here. No apparent hazards.
Always check the scene. Check call care, remember?
Not quite.
Okay.
First, check the scene for hazards.
Okay, we did. Right here's one.
Nice work. You've identified the spilled milk as a potential hazard. Not quite. First, check the scene for hazards.
Okay, we did.
Everything looks okay over here. Good. You've checked the scene and identified all potential hazards. The scene is safe. While checking, you didn't notice any severe, life-threatening bleeding.
Okay, so you have a choice: obtain consent, interview, come down here and over here.
What should you say to obtain consent?
Explain who you are, your level of training, what you see, what you plan to do.
Yes, please help. Thanks.
Okay, so we go through.
My wrist. It hurts pretty bad, but I'll be fine.
Any allergies? We're going through sample.
No, I don't have any allergies.
Medication.
No, I don't take anything.
Okay, so we know with sample, SAMP, ask if he has any medical conditions.
I don't have any medical conditions.
Last food or drink.
I just had a ham sandwich. I slipped in some milk and guess I landed wrong.
Good work. You've gathered enough information. A quick
So,
head-to-toe check shows no other injuries or conditions. Now, you should give care for his wrist. The wrist appears swollen, but the skin is not broken.
so we just went through sample. As you know, the last was the E with the event. Use the R.I.C.E method to care for the injury.
How should you use the R.I.C.E method to care for Anthony's sprained wrist?
Okay, so we know this is the method we're going to use. Rest, immobilize, cold, and elevate.
Nice job. Now you should monitor Anthony for any changes in his condition.
Hey, thanks. That's definitely helping, and it's starting to feel better already.
Nice job. You used the R.I.C.E method on Anthony's wrist. First, you rested the area. Then, you immobilized it by wrapping the area with an elastic bandage. Finally, you applied ice to the injury while elevating it. Remember, when wrapping a wound, it's very important to check the fingers before and after for feeling, warmth, and color. This way, you can be sure there's still circulation below the wounded area. Now, you should suggest Anthony see a healthcare professional.
Okay, return to home. We're going to pause. Okay, at the end of that, remember to check if you see any bluish coloring, you know that there's not circulation going to that area. So make sure the bandage isn't too tight. And again, at that point in time, you would call 911 or transport. In most cases, call 911 and get immediate care. So we're looking next at head, neck, and spine injuries.
While head, neck, and spinal injuries make up only a fraction of all injuries, they can cause some serious problems, like speech or memory problems or paralysis. In some cases, they can even be life-threatening. In order to care for someone with this type of injury, you have to first be able to recognize the signs and symptoms. A head, neck, or spinal injury should be assumed in a number of situations, including those in which the person is unresponsive, was involved in a motor vehicle crash, fell from greater than a standing height, is wearing a helmet that is broken, complains of head, neck, or back pain, is not fully alert, or was injured while diving into a pool or other shallow body of water. It's important that you talk to and comfort the person, but do not touch them. When asking the person questions, encourage verbal answers instead of head nodding or shaking in order to prevent further injury. A concussion is a traumatic brain injury that involves a temporary loss of brain function resulting from a blow to the head. Signs and symptoms of concussion are confusion, repeated questioning about what happened, temporary memory loss, nausea and vomiting, speech problems, blurred vision or light sensitivity, and headaches. If you suspect a person suffered a concussion, call 911 or ensure the person is evaluated by a healthcare professional.
Okay, so a couple things. One you may be confronted by is concussion. You can usually, with the person, if they were unconscious at any point in time, obviously you need 911 and transport the person immediately. Again, if you talk to the person and they feel nauseous, dizzy, pupils not dilating correctly, and or headache, you ask a simple question: what day is it? What did they have for lunch? What did they have for breakfast? A lot of times that memory loss will be lost. Again, with that concussion scenario, make sure you do get the person to a doctor and let them be evaluated. If at point in time, if they do and are sent home, you would monitor the person through the event, and that may be 24 to 48 hours as well. Um, so we know muscle, bone, and joint injuries, head, neck, and spine injuries. Not a lot you do with those. Most of the cases would be immobilize the person, do not move them, and with the neck or spinal injuries, uh, and call 911. And always check call care. When you check the scene for a safe situation, call 911 and care to the point that you feel comfortable. And with the head, neck, and spine, in most cases, it's the person being comfortable and immobilized. If you have any questions, again, please email me. Pretty short lesson, 11 minutes. I wish you the best. And again, one more time, if you're struggling, if you have any questions, whatever it may be, please email me for a test retake or questions. Of course, you can always go see Mrs. Grove and Mrs. Laurie Grove, my better half. She'll either get in touch with me or she'll say, "Hey, call Mr. Grove, call Ken Grove." That being said, I wish you the best. Take care and return home. See you next week.